COVID tests in the NT were processed in that time period. And it is concerning that we've seen a 26% decrease in testing, but we've seen a significant rise in case numbers percentage-wise off that. So many of these cases would have been contracted before the mask mandate on New Year's Eve, but still concerning that we have so many cases. I just want to go back to yesterday's cases. We had 21 cases outstanding when I spoke to the community yesterday. Of those 21 yesterday, 16 were travellers or close contacts of travellers. 5 were community transmission. So yesterday I advised there was 6 community transmission. Upon further investigation of those outstanding 21 cases, community transmission yesterday rose to 11, and community transmission today is already at 14. And the CDC are working through those remaining 28 cases where we don't have an obvious link as to why that person has tested positive. Close contacts, we do have 540 known close contacts across the Northern Territory, and of those 409 we've been able to make contact with and they're in isolation, and 306 have returned a negative test. I'll just turn to the regions because I know that people in the regions of the Territory are very concerned around COVID, and just provide a breakdown of some of the testing that has come back in from the regions. I can say at the outset we don't appear to have had any cases in the last 24 hours that relate to the Territory regional cluster. All of the cases are new cases relating to interstate travel or contact. Nhulunbuy has had 10 new cases of COVID-19. 6 of those are close contacts of cases that we reported on yesterday, and 4 are recent interstate arrivals. So a concerning number of 10 for residents of Nhulunbuy, but they have all been linked, and we do have exposure sites in Nhulunbuy. Katherine has had 1 new case of COVID-19, and that's linked to a household contact of an already reported case. Jabiru, we have got 3 cases of people that reside in Jabiru, but they are all connected to cases within Darwin, so we know the source of transmission for that COVID. And in Alice Springs, we have 2 new cases. Both of these are interstate travellers. And yesterday we had 3 cases that we knew had tested positive in Alice Springs. They had been through the testing facility there, but we weren't able to provide details. I can confirm today that those 3 people were also interstate travellers returning. So 2 new cases in Alice Springs today, both travellers, and the 3 cases we reported on yesterday were also travellers. There is a significant number of exposure sites across the Northern Territory. There's 72, I believe, on the website, and that number is expected to increase. And the Centre for Disease Control teams, once they have the appropriate information, they go through a process and will load that information. So people are encouraged to keep checking that exposure site website. People should also make an assumption when they have people come to their home, or if they leave their home, that there is community transmission in Darwin particularly of COVID-19, and they should take precautions and manage their health. On New Year's Eve, we explained that we would be having a new system where if people visited an exposure site, they would be sent a text message and encourage them to monitor for symptoms. So that has been taking place. And so if people get that text message saying that they've been to an exposure site, they do need to understand that they have definitely been at a site that's been identified, and they should really be conscious of their personal health. And we flagged that we'd be moving away from listing every exposure site. We'll endeavour to do so, but as we get more and more exposure sites, it will become less and less practical. So we have certainly a significant number of cases in the Territory today, 95. Our teams will continue to work through those outstanding cases so we can identify the sources. But as we have more and more cases, it's going to become harder and harder for our teams to identify those sources. So we all need to take that personal responsibility of wearing our masks, making sure that our vaccination is up to date. If we're eligible for the booster, please go and get it.